Alternative Dig Talk. Real issues, real talk.
Hi Rogers, can I ask you something?
Shoot.
What does corruption mean?
Well, summarily, corruption is abuse of public power for personal gain or for the benefit of a group to which one owes allegiance. For example, when a public office is abused by an official accepting or soliciting a bribe. By the way, private people can be corrupt too, like bribing police officers to escape fines.
Okay. So exactly how does that concern me?
Well, do you pay taxes?
I guess, yeah. What does that have to do with this?
Everything. Because those taxes you pay are supposed to facilitate services you use, like water, electricity, roads construction, medicines in hospitals, name it.
Okay, that is much bigger than I thought. But it can be stopped, right?
Well, yes it can, although it may not be as easy as it sounds. And here is the reason why. Corruption roots are grounded in our country's social, political, economic, bureaucratic traditions and policies.
So, what has kept it going this long? I mean, why don't we stop it?
Well, the main reason why it has been here for so long is because institutions are weak, either as a result of poorly defined ethical standards of public service, weak administrative and financial systems, or ineffective watchdog agencies.
What can we do to stop it?
At a national level, we must focus on strengthening the independence and effectiveness of public institutions that fight corruption. At a personal level, we must commit to never giving a bribe.
I promise I'll never give a bribe.
Well, that's a great decision you have made. Me and you now have to spread this message to all our friends. If we all do our part, corruption will be no more.
This message is brought to you by Alternative Digital.
Looking for a pair of shoes? Les Heps Stores has a wide range of selection for unisex footwear. We have the best quality of all brands at pocket-friendly prices and with neck deliveries countrywide. Just place your order or reach us on 0772 08 0090. You can also check up at Les Heps Stores on all our social media platforms. Les Heps, craft your own footprints.
The Alternative Dig Talk. Real issues, real talk. The Alternative Dig Talk. Real issues, real talk.
Welcome back from that break. You're still watching Digital TV. My name is Edgar Matthew Karahanga. If you're just joining us, we are having a conversation about vital statistics in Uganda. These are civil registration and vital statistics of this country. Remember, statistics are very, very pertinent, especially when we are to build a better Uganda, because they shape our decision-making processes. And to have this conversation this morning is the regional manager for Heps. They will be talking about that organization and what it does. That is Offiti Robert. But before I welcome him, I have Septinde Apollo. You're watching. Thank you so much. You say Uganda yebadde ensi yaba Pharasians, Caucasians, cowboys from Ethiopia, Jukila, and Tieno Yensi and Suvize, Abayudaya Jeva Singa. Kwetaga, the holiest Canaan land part of Africa. You're really very passionate about your country. To him, Mr. Norman, thank you for watching. Then Henry Manjeni, Kasule, Ismail, Mukasa, Babi, Brooke Williams, Chikomeko, Mwesige Joram from Kienjojo, Judith Nalukwago, Henry Lwoy, all watching. Thank you so much for tuning in. Allow me welcome the regional coordinator for Heps Uganda, Mr. Offiti. Robert, good morning and you're welcome once more.
Good morning to you, Matthew. Thank you for hosting us on Digitalk Media, and we are glad to be here.
It's always a privilege to contribute to the conversation. Just tell us more about Heps. What does Heps mean? Heps Uganda, for those who are just hearing it for the first time.
Coalition for Health Promotion and Social Development is the name of the organization.
Yes.
But the acronym is Heps Uganda. We are located in Nakulabye, Balituma Road, and we are 25 years old. We are a national NGO, and we work with government and other stakeholders to see to it that we ensure access to health and socio-economic resources to all Ugandans through advocacy, research, capacity building, and collaboration.
Wow.
Our goal is to see that every Ugandan is able to achieve or reach socio-economic and health outcomes that they aspire to have.
That's beautiful. And you've been doing this for the last 25 years.
Oh, yes.
How has it been working in such an ecosystem like Uganda?
Uganda has a number of laws as per the constitution, and as an NGO, we work under the law that governs this country, Uganda. We have the NGO Act,
Yes.
which empowers us to register and operate while honoring all the legal frameworks. And as we work, we have enjoyed working with all government ministries, departments and agencies, local governments, which are districts now, but also we work in coalitions with other health practitioners who have the same mind in terms of accessing universal health care to all Ugandans, and those are other CSOs, CBOs, and individuals. And our funding basically comes from international organizations, philanthropies, but also individuals who feel that we are able to bring services to where they need to be. And by doing so, we've been good in what we do in terms of maternal, child, neonatal health, HIV, in terms of advocating for TB, reproductive health, issues to deal with how to empower the girl child, integrating gender into what we do. But to do that,
Yes.
we do it through research, existing data, and that is why we saw to it that it is necessary to strengthen systems upon which government bases to deliver services to Ugandans.
So you're like that bridge that you're doing most of the research, but you're doing it for government, on behalf of government, to make decisions. Is that what you're saying, sir?
We support government.
Okay.
Government is like dad of the family.
Yes.
And so we work in its compound lawfully, and so we use its research, and we monitor what it is doing, and in our monitoring, we are able to do surveys, we are able to do studies and assessments and say, hey, look, you said you are going to provide these services in terms of maybe maternal service, but we see that in health facilities, maybe magnesium sulfate is not enough, or it is out of stock, and so mothers with preeclampsia, some of them are dying.
Yes.
But what can we do now? So please do A, B, C. So we come up with proposals and put them on table.
Yes.
So it is out of this monitoring that we get data which we report, and when they verify it, they are able to take action. And when we have partners like Global Health Advocacy Incubator, we are working with in CRVS, then they say, please, we are giving you support. Now, see how registration is working and how it can inform data for health for better service delivery in the country.
Wow,
Yes.
I can get you. So you actually shaping policy in the wide scheme of things,
Yes,
and
we
you're
do.
holding government accountable according to what they promised or what they even say themselves to say that you say this. What is the impact that you have created so far in the last 25 years, if you are to say that this was maybe a blossom for the works that we have done as Heps Uganda?
At national level, we have been glad to note that we work through collaboration and we contribute to. And so in partnership with other actors, we have able to contribute to improvement in access to health,
Yes.
where we have issues to deal with gaps in service delivery for health. We have been able to contribute to access to HIV services, TB services through our monitoring work. We have programs like community-led monitoring, where the community living with HIV is able to monitor and report whether or not they are getting services. And through that, we identify enablers which help government appreciate what is working, but also disruptors to health service delivery.
Yes, sir.
And so we are happy to contribute to such work, but also in maternal child health, we have been able to contribute to reduced death due to preeclampsia in the country by advocating for increase in availability of reproductive health commodities like magnesium sulfate, which is used to treat mothers who have hypertension during pregnancy. We have been able to contribute to things like information dissemination to communities, where we advocate that people need to know their health rights, and when they are able to do so, they prevent disease instead
Do
of
you do
going
that
for...
through drives, campaigns? How do you do that advocacy itself?
Yes, campaigns are part of them. We have been part of cancer campaigns, TB campaigns, WASH campaigns, water, sanitation and hygiene. We have been part of tetanus campaigns in the country, HIV, AIDS campaigns. But also in communities, we work through district local governments and the Ministry of Health, and then we are able to organize outreaches to extend health services closer to communities that perhaps are far from accessing.
That's where I was even
Yes.
going to come.
Yes, so we work with the district health teams, and we are able to organize community outreaches which are integrated, such that we have a consortium of health services reach out to communities
Yeah.
away from the facility, which is static. And so by doing so, we work in collaboration with health facilities, the health workers, the local government staff, such that we know that numbers that are not able to access health services are able to access them and access them with quality services and commodities that government provides.
Wow, that's extremely brilliant a job that you are doing, but you're mostly relying on, as you said, donations of funding and grants, things like that. How sustainable is this, especially when we are at a time where most of the NGOs and funding for projects like that is continuing to shrink globally, but also in Uganda here? What is the future for Heps, especially in financial sustainability for you people as an organization?
As an organization, our board has a strategic plan, and one of the actions and strategies it has is to have investments as an organization. And it is from those investments that cushion such challenges when they come, to ensure that Heps is able to continue programming, even when we observe the fact that there is shrinking space and also funding stream that leads to decline in funding. So yes, that is happening. It has shaken us, but it is not the first time. We have gone through this before and we have bounced back, just like other strong NGOs and civil society organizations in the country. And we are glad. That's why we are here. We are now here again to continue talking about civil registration, and vital statistics.
Thank you, thank you. We are still with Robert Offiti, gentleman from Heps, Uganda. We just wanted to first find out about Heps. But before I leave you to enter the statistics bit, there is also giving them wisdom or giving people knowledge about these issues. Sometimes one would say it's not enough. Are you doing something? For example, you said you are moving with medical helpers or medical practitioners. Yes. Do they actually treat these people if they phone someone with that condition you mentioned? I don't want to say it because I'll bite my tongue. But that condition, for example, can they treat them? Is there impact that you can say, at least someone will say, because of Heps, I have a condition directly that has been helped out?
Yes, we have people who have been treated.
Yes, sir.
You see, in Uganda, the responsibility to provide health services is upon government.
Yes.
And they have an array of health facilities and staff who are there, so whom we collaborate with. And so when we advocate for policy, policy guides how things should be done, policy guides how the public should be handled and where they should get resources. For example, a health center 3 at that level, policy says at that facility one should receive immunization, should receive maternal child health services, should receive treatment and all other preventive methods for malaria and other diseases in community. But also that facility should be able to promote preventive measures in community through other structures existing like the LOC system and the VHTs.
Yes.
And all these are establishments that Heps works with. And we are confident that people have been treated. People have been receiving treatment, but that is not to say that that is the only thing we do. We also contribute to dissemination of information, just as we are here today to talk about civil registration and vital statistics. It's important for people, one, to prevent disease, and it is their right to have access to health information, but also have access to health services. So these are some of the things we talk about in communities as we engage and even participate in planning and budgeting processes on behalf of other CSOs, but also in coordination with other stakeholders.
Okay.
And so we are happy that the work we've done has led government to recognize what we do and even international development partners to trust us with their resources up to now.
Thank you. Thank you so much. I have a copy here of the civil registrations and vital statistics in Uganda. It's actually an information brief. It's more of what you may call notes. He teaches you what is civil registration, the meaning of vital statistics, the purpose, value of these things, the CRVs enabling policies for you who's just joining. We're going to be highlighting on these. They talk about key CRVs institutions and their responsibilities, the current situation in Uganda, how it stands, the birth notification in health facilities, birth registration, birth certification. Before we even delve into these numbers, I was reading through them last night, but how credible is this data? You know, in this country we have a problem of mistrust, and he who pays the piper determines the tune. So you are interpreting data, but before you even talk about these civil registration and vital statistics, how can I trust the statistics that you are bringing here to this morning?
That is one of the things that Heps Uganda is good at, ensuring that the data we share with the public is closely scrutinized, vetted, that it comes from credible sources. Your statement is correct, and that is why Heps has taken time even to come up with such information. And so the source of that information, one of them is the Uganda Bureau of Statistics, which conducted the previous census in 2024. And so we base on that. But also we have data which comes from reports of the National Identification and Registration Authority. We have other sources like the UN. We have others like Ministry of Health, which we read and try to triangulate this data such that when we go out to communicate, we are able to say, according to this source, which is a government agency, And that this government agency did this work and even disseminated it. That's why some of that information sheet does not have a lot of statistics. We are looking at what is credible and that has been authorized for the public to use. And that's how we contribute to policy reviews, to research and improve.
At least you have established credibility.
Yes.
For me, this is something that was pertinent. I fact-checked the president who said that Uganda was a middle-income country by 2022, which was not. And he was using UBOS, but I also understood where he was coming from, and I used other entities like World Bank to juxtapose and say, this is the verdict. So if you say that you don't just believe gullibly as UBOS gives you and you just collaborate it with other agencies, then we can establish credibility. So for that person who's listening about civil registration and vital statistics in Uganda, what does this mean and why is it important?
The United Nations defines civil registration and vital statistics as a continuous process which is universal, meaning everyone, everywhere, at any time. And it is continuous, meaning things change. So it is a continuous, universal process by which events pertaining to persons or individuals are registered into a system by recording information about them
Yes.
according to the law established in that country. Now, what do they register under CRVS? They register births of a human being. They register a death of a human being, marriage and divorce, as well as adoptions. These are regarded as vital events in someone's life.
Exactly.
Birth, death,
And the wedding. Those are the parties that we celebrate in life. Yeah, the three vital
of course,
parties, yes.
one which is normally celebrated is the marriage. Yes.
Yeah.
So the marriage, the divorce as well, which is normally unfortunate,
Yes.
but also adoptions. And so in Uganda,
Yeah.
we have a law, a legal framework, which guides how this should be done. But as per the Constitution, the mandate for registration by law is established by the Registration of Persons Act as amended 2024 in Uganda. It is the act that establishes the National Identification and Registrations Authority, which is NIRA.
Yes.
But doesn't work alone. It works with other ministries, departments and agencies, local governments and other actors, including you and me, who is the citizen.
Yes.
Because their services are ours.
Exactly.
So it is our responsibility to go and access these services.
Yes.
And so the discussion today is what it is and why is it important.
Yes.
You see, we have a law in Uganda which says that every citizen shall be registered after birth. And after registration, they have to be accorded a national identification. Now, in Uganda, when you have a national identification, it means you have a national identification number. It is one which will show that you are Ugandan. No one else has it. So I'm coming to the importance of CRVS.
Yes, yes.
Why are births registered? Why are deaths registered? Now, I'll start with births. One, it is proof of legal identity that you are a Ugandan, not a South African. You are born maybe in Bali, and the system should be able to know that Matthew or Robert is born to Mr. So-and-so and Mrs. So-and-so of this place. Okay?
Yes.
And in the National Identification Register, you are accorded a number as a citizen of the country.
Yes.
Now, where does that happen? Births happen in health facilities close to 50% of births may happen in health facilities,
Yes.
but other births happen in communities.
Yes, at home.
At home, others now have traditional birth attendants in the villages,
Yes.
but other births happen, for example, in prisons.
Yes.
Now, there are systems under the law that guide that when a birth occurs at a facility, the officer in that facility ought to guide the mother to notify government that Robert Offiti or Matthew has been born today, and this is the name to these parents and all this, such that that person already feeds into the system
I get you.
as a statistic now. Is he or she female or male?
Yes.
Now, we are going to the bit of statistics. Those other details which are necessary for analysis,
Name of
such that
mother, where they come
where
from,
they come,
ID number,
the ID
things
number,
like that.
even the date. The date of birth gives you the
yes.
year, such that you are able to scroll and say, in this year, in this month, these are the people who were born. You get. So that one is a source of this of data about the number of Ugandans born where to who. You get.
Yeah.
So, one, it is proof of legal identity that you're Ugandan. And so every parent should do so. It is a responsibility of Ugandans, every parent, to register their child immediately after birth,
Exactly.
not when you can't avoid it.
Because we realize there are many people who grow even up to like 13 and they don't even have ID. When
This is
the
it.
country does not know them.
They
You
go
know,
to
but
register
don't
for
know.
PLOE, and
Yes.
now they are running up and down.
Looking for the birth certificate. Yeah, you know. Yes, exactly.
Can we, okay, if you don't have a birth certificate, okay, bring a birth notification. And then what is the date to prove as date of birth, the name, the parents, and all that. Then you know you need a NIN with the time as you grow in the education system.
Yeah.
So that is now the second.
Yes.
The other one, in terms of health, this statistic informs data for health. To
Yes,
plan how many children do we have, and therefore how many vaccines should we plan for?
Yes.
How many commodities in terms of medicines and health supplies do we need to plan for? Where do we take health facilities? How do we upgrade them from health center 3 to 4, given the population in that area? How many health workers do we need to employ?
Yes, sir.
And therefore, how much money do we need? So, data for health, these statistics here from CRVS informs planning and allocation of resources. But also, it helps government to know what things are affecting the population in terms of disease surveillance. We shall be able to tell that in this region we are having this disease. You talked about Mpox.
Yes.
If our system of CRVS was fully functional, up to date, would be able to track who is so and so by just clicking in a NIN of someone, and you know where they have gone for treatment, and who has worked on them, where they come from, their behavior. That is what other countries have
Exactly.
reached.
I was going to say,
and that is why we
are doing it. We have a Zoom.
and that is why Uganda is trying to see that reach that level.
Wow.
Such that when you go to get a passport, they are not again asking you to produce forms, go to the LOC, go to the RDC. The issue is, what is your NIN? The passport office should be able to get your data.
Yeah, when they just put in that.
When you go to the bank, they shouldn't be asking, do you have an ID? Is it expired or not?
Yes.
These are the
Fingerprint,
things. Is it fingerprint or the NIN?
Exactly.
So the NIN is entry, the fingerprint is another way of yes, biometrics. Now they are going to add the iris, just to be more definite. So in terms of health, we are saying that we need the statistics, and it all comes from birth registration. So when the health system has this data, and also the community, for children who are born in the community, a VHT, Village Health Team, and LOC should be able to notify the sub-county chief or the mayor in a municipality. They have a system to record this and notify NIRA that, you know, in our municipality, in our sub-county, these are the number of births this month, this quarter, and then NIRA does its job to assign a NIN, and then they wait for that child. As the child grows, with the time, they'll get an ID. I think at the age of 16, they're able to get an ID. But they have to go through a process where the parents go and apply for a birth certificate, which is legal proof that you're Ugandan. Having a birth notification is not legal proof that you're Ugandan. It's just a process to notify. That's what it's called, notification. Yes, just notify.
Yes, sir.
So that information is important, as I said, to plan and allocate resources in health.
How about the death itself?
Now, when it comes to death, on finance I had talked about it. Banking, you need it.
Yes, sir. Yeah.
People missed PDM, the parish development model.
Yes.
Just because they didn't have IDs,
exactly.
they missed it out.
Many
Even
campaigns,
associations.
many campaigns that miss out.
Yeah, because of IDs. So Ugandans need to do that and get IDs. So even in travel, people normally suffer. Others pay hefty fines because they don't have up-to-date identification documents.
Yes.
And so it is important that Ugandans do it early. Now, for today we are on birth registration and death registration. So for death, government would like to know how many people have died because of accidents, for example. This is a normal thing we see. You see, when someone dies, by law, there has to be a medical certificate for cause of death.
Autopsy.
So we normally have, in the health facilities, we have maternal, perinatal death reviews to account for the death of that person, despite the age and gender. That is on record. Now, that is not done with NIRA. Ministry of Health does it, and it has the records there. But that information is not accurately and timely shared with NIRA. Okay?
Yes.
Such that people are able to know. These have died because of accidents. These have died because of maybe overbleeding. These have died either because of diabetes. These have died because of cancer. That should be coming in such that when this information is shared for cause of death, the information is relayed to the Ministry of Health. It is analyzed, shared with the NIRA, and then UBOS, the statistics agency, lead agency for the country, is able to publish an annual report showing the status of civil registration and vital statistics in the country, such that even banking communication uses the same information to say, hey, this person was having a loan, for example. The loan is not being paid. Is this person dead, or what could be the cause? But you see, death is not declared because the family perhaps is still getting money through the ATM.
Yes.
But this person is dead. And government is still paying salary for the ghost workers or civil servant. So I'm bringing back to you the importance of death registration.
I see even, in fact, we've heard of what they call the death rate, where, in fact, these days the government is trying to encourage people to get married. They're putting in incentives, please get married. Because from my perspective, I think after interpreting the data, they see where the problem is. And it's, I think we're having a low birth rate. How do we improve this? Isn't that in the long run?
In the long run, those are some of the explanations that come up from different agencies. But we want this to be centralized when the system is speaking to each other. And so one of the importances or the benefits of having this registration is that people get to know, one, the cause of death for their loved one.
Exactly.
Government will also be able to account. That is one. Then two, the other benefits. Others are inheritance issues. Others are family issues. Others are for health. Government will be able to know what is leading to cause of death. Now, if it comes to accidents, a policy will be initiated to guide how best can we reduce death due to accidents.
I get you, sir.
If it is drowning, for example, in water bodies, a government will come up with regulations using that statistic and say, you thought there are few people who are dying, but even one person counts. Why do we have people die on water?
Exactly.
Why do we have people die in the swimming pool, for example?
Yes.
What are the regulations, therefore, we are putting in place to guard citizens from death?
Wow. I get it. So these, generally the statistics help us to shape decision-making processes for individuals, government organizations, and everybody really. I know that
investment.
Yes. I know there are some challenges that you get, especially when you are getting such data in field. Can you take us through the process? How is it, and of course some of the challenges that you've been grappling with in that regard?
According to UBOS, in the previous census of 2024,
yes, sir.
it said, it reported that only 31.4 Ugandans have notified their birth. But of those, I think only 11 point something have birth certificates.
That's true. That's very true.
That leaves us with the 1 out of 10 people without birth certificate. Now, that is a big number. We appreciate all stakeholders have tried to do that, but there are challenges that are there that are causing this. Sustainable development goals have a target that by 2030, for example, there should be 100% birth registration. 2030, today is
2025, 5 years. The SDGs.
The SDGs, I think SDG 17, it has some targets. It also goes ahead to stipulate that by 2030, we should have 80% of death registered. But in Uganda, I think it is less than 5%.
Yeah.
Death registration.
Yes, that is very true, by the way.
Is less than.
We only register when we need that certificate. In case there is maybe inheritance issues, there is bank you have to get. We rarely, yes, we rarely register
land
deaths.
issues.
We rarely register deaths,
yes.
sadly.
Yes. So, you see, there's a big gap.
Yes, I'm saying.
The same applies to birth registration. Now, there are many things in there, ranging from the law, others are financial, others institutional coordination, others are public information and awareness issues.
What's wrong with the law? Isn't the law clear enough?
The law has enabled registration of persons, but it has not been explained to the public to understand. For example, it will say that a person should be registered immediately after birth. So what is the definition of immediate?
Yes.
Is it in 1 hour? Is it after 1 week? Or is it 1 month? What is immediate? But when you go to the NERA regulation, registration regulations, there is now a fine. When you register a person after, I think after between 7 months, let me just be clear for the record. When you register a person between 7 months and 6 years, there is a fine of 10,000. Yes, you're late. It's no longer immediate. And when you go between 7 years and 18 years, you have to pay 20,000. I'm showing you that. Now, the public does not know this information.
Exactly.
But it comes from the law. So, to define what immediate means should be very clear.
Tell us, the child should be registered between 7 to 14 days after birth.
Exactly.
Be exact.
Let it be such that, and state who does it, who should do it.
Yes.
Of course, the guidelines say in the facility, the in charge and all the medical officer should feel, NERA has its birth notification registers at every facility from Health Center 3, because they do they have maternal and delivery services. So that should be clear even to them. And also it should be included in the key performance indicators that if you as a midwife does not report as part of your work the number of children or births you have notified government about, then you are not performing in this area, such that it is incumbent upon them to be interested, and it becomes their responsibility to ensure that as a mother is in labor suit, the next step, as the kid does, BCG is given, and after that, birth notification details are done. And so I'm coming to the challenge.
Yes.
What the law is not doing. Now, at institutional level,
Yes.
how are the public servants supposed to notify, inform the public, be doing? Our health workers, for example, they do a lot of work we appreciate, but now they need to integrate birth and death registration or notification, this matter, in day-to-day work, that in antenatal care clinics, they integrate birth notification. As you plan to come for delivery, please come with a photocopy of your ID and that of the father of the oncoming baby, such that it helps us to notify government about this death. Come with a probable name, all those details, such that by the time the mother leaves, everything is registered. If they miss for some other reasons, then during immunization process, because immunization goes on, after 1 year, this should be done. So information in the public is missing. Public awareness has a big gap.
Yes, I get you.
We did a Track FM public engagement. Track FM uses software to engage the public through other radio stations. And the statistics which came out showed that about 61% of the public don't have information about birth registration. Others hear about it, but what is the benefit of registering? What is the benefit? After all, we've been there, it rains and it shines and we have our food. Why should I bother anyway? That is one. The public has lack of clarity about these fees I'm talking about.
I did not know them, and I'm a journalist here.
Yes.
I did not know them.
Some of those fees they don't know. But also, the other one is the distance the public has to travel. In the investment case we have conducted with support from Global Health Advocacy Incubator, Heps has been able to get shocking information that some people have to travel between 30 to 50 kilometers just to reach a district NIRA office for this service. Then when you go, they say, no, you need a letter from the LOC for ABCD. And you've moved and this is a mother who has a capital of 40,000 selling tomatoes in those markets in our village.
Yes.
And she has spent maybe 25,000. When do you think she'll go back?
She cannot. She won't.
To notify, to look for that.
Just to notify you, no, she won't.
And that's how some of them missed out on PDM. Because the long distance, they are not sure whether they will get what they want. So they're like, let me go on the way I normally live. So distance is a matter. But also there are districts which don't have registration offices.
NIRA offices.
Yes. They are now above 20. Yeah. The last time we had, there were 24. But also there are other urban authorities that have come up that don't have these offices. Now that one compounds the problem. Then human resource in NIRA, it is at staffing is at 50%. It is also a budgeting problem. When you go deeper, little funds are provided. Okay? Not only to NIRA, but even other MDAs that do registration or information collection from the public, like Ministry of Health also.
Yes, sir.
The health information system needs to have more allocation of money such that some of this information is relayed to the health workers who are serving communities such that they know it is urgent, not the work of NIRA. Because it is them who deliver the mothers, isn't it? And they have registers. So it is just an ethical issue to say, let me notify government that under my custody, I have a new Ugandan. And you submit. In fact, should be a NIRA registration officer to pick that data. So they also have issues of funds to ensure monthly or quarterly collection of this data to be input in the system. So I'm bringing on another challenge. There is lack of interoperability.
What is that?
This is where systems of MDAs have to collaborate or interlink. That for me, when I'm having information about birth and death, there is where I post it, and someone from the other the other agency can access it for use, analysis, dissemination, something like that.
Like what is done, for example, on passports and permits, that right now I don't need to speak my name and my everything. I just bring my NIN number or my NIN number and I say, this is my NIN, give me a driving license.
Exactly.
Okay.
Exactly. In some countries, you will see if you are got, for example, for drunk driving by a traffic officer, just a mere tap on your database, they will know that is not the first time.
Yes.
You have committed that
offense.
That offense.
Yes.
They will even know where you come from. Some key information you should not get in public. Yes, but they have it, and this information is very private. One of the things the public is concerned about is with my privacy.
Yes.
But it is private. It is confidential information, and therefore it is highly guarded. Okay. Yes. So the public doesn't need to be worried of it.
About
yes.
that. Okay.
So the other challenge now we have, I've talked about interlinking agencies. We've talked about budgetary allocations. We've talked about issues to deal with the public information.
Yes.
The issue is stakeholder coordination. Some of these things are like a prerogative of people who can afford.
Yes.
Yet it is a right of every Ugandan to be registered and to be known. If a birth is not registered, then it means that such a Ugandan is not being recognized, which is not a good thing.
Okay.
Yes.
I don't know. Can these problems be addressed? Can we improve access in your thinking?
Why not? Why not?
How can we do this?
One of the things we are happy about as Heps and GHI is that we have taken this out of the books, out of the websites, and tried to create public awareness. And so people have started to ask for the services. And so when you ask how can this be done, the first thing is to create awareness in the public. Let people appreciate that it is their right and it is mandatory, because where we are going,
Yes, sir.
if health services need your NIN, how many people will miss out?
Many.
Many will need. If they say you are an adult, just bring your ID. How many will miss out? Many.
Yeah.
The elderly, who thought, nze ndi mukadde seetaaga ebyo, nze nedda. They are still alive, and Ugandans who need to be known in the system. So public awareness creation is key, and it takes all stakeholders, not only NIRA. It is incumbent upon me to ensure my children are fully registered. I shouldn't be pointing at NIRA.
And we're waiting for NIRA to remind us.
No. It should be that I know this, and that when I do it, I'm satisfied that yes, my family members are registered. So it is very important for all stakeholders. We want local governments, district local governments, to take up this. Of course, we are aware that we have NIRA offices in more than 100 districts and urban centers. But somewhat when stakeholders are mobilized,
Yes, sir.
registration officers are not involved, because that is where they would now notify the stakeholders, technical team, the political team, the administrative team, that look, this is not happening.
Exactly.
How can we work on this to improve?
And they are vital
But
because they actually
exactly.
they interlink, yeah.
Because the planning and budgeting cycle of Uganda starts at parish level. PDM has a pillar for data, has a pillar for health. Now, this information is key to be integrated, even in the PDM programs that are going on, because it is the district local governments that are initiators of the planning and budgeting process. So if they don't know the people they are planning for, they get wrong plans.
Yes.
They don't know. Someone died and the system is still counting that someone exists.
Exactly.
Someone got born again, got born, but they are still,
Don't know that.
they think we are still few people,
Hey.
yet we are increasing. I'll give you an example. If you are in a family, there is holidays time when a family is full board,
Yes.
and there is a time when they are at school. Now, what brings that is when kids at school, the budgets have to also be tuned accordingly, isn't it?
Yes.
And when they are back, every guardian and parent is saying, oh, I have full board. Budgets are increasing.
Yeah.
Guys have to go to church, guys have to eat, guys have to do a BCD, my shoe got spoiled, those repairs and what.
Yes.
So, if a parent does so at home, how much more should government do for 45.9 million people?
Yes.
Yes.
Exactly.
So the other strategy is increase funding. Increase funding to the CRVS agencies. Of course,
To the you.
yes, yes, increase funding.
Exactly.
So of course we appreciate that
People
336 billion was given to NIRA
Yeah.
to do the mass registration and renewal, which has been already organized.
Yes, it's.
And I
it's
think
going
they
to
are
be
training
implemented.
registration officers to start doing
I
the
think
job
this
in
year.
April. Yeah.
This month.
Yeah,
exactly.
this month they are starting. But after the campaign, so do you go back to the same?
The default settings.
And then we wait for another campaign which will take now maybe 400+ billion, and it has taken a long process to have even that money allocated.
You remind me of the population census, how we disseminated money in November 2023 for a project that was going to start in 2024. And we always know that every after 10 years we do a population census.
Exactly.
I know what you're saying.
Yes. Yes.
I see.
Now, how about if they had said this 366 billion is divided in every financial incrementally, that we are going to add 50 billion on the budget of NIRA to ensure that NIRA has a national office. By the way, NIRA's office is under Ministry of Defense and Veteran and in Kololo.
Yes, I know.
Yes, it is not
The
their
headquarters.
property. Yes,
Oh, okay.
they are just there for some time. Now, if that money is allocated, they can know we are going to construct a fully fledged national headquarter for NIRA, such that when there are other national events, work still goes on.
Okay.
We have district offices expanded, staff employed. We have budget for community outreaches, where district officials can't reach. There can be outreaches as well to reach far located communities for registration, but also train all people, retool people in health systems,
Okay.
reporting and registration, the health workers, the VHTs at committee level, the VHTs and the LOCs need to be given this information such that it is part of their community mobilization.
Okay, because of time, I'm going to stop you there. But lastly, What are some of the ongoing projects? What is happening at Heps Uganda for today, but also for the future to come?
In terms of statistics, we have had work going on. I told you earlier to have community-led monitoring, which monitors access to HIV, TB services in the country. That is one. Two, under this, we are working with health facilities and health ministry to see to it that this is integrated. The Permanent Secretary for Ministry of Health urged all stakeholders, particularly in the health ministry, to ensure that health services are integrated following the exit of USAID funding, you remember?
Yeah.
And so we are proposing that even on that, let birth and death registration be strengthened and integrated in the day-to-day work of the health workers at the facilities. Yes.
Okay.
Yeah.
Thank you so much, Mr. Ochit. It was a privilege having you this morning. Now it's time we take a break. You're still watching the Mighty Drive Show. My name is Edgar Matthew Karuhanga. When I come back, I'll be joined by Charles Onyum, who is the media coordinator at the Global Health Advocacy Incubator. Let's take a break. We'll be right back.